don't know if anything official has yet.
We'll get started with the flag salute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone, and welcome to the Shawnee County Board of County Commissioners work session. It's October 16th, 2023. And Angela, what do we have today?
Good morning. We have Connor Clune and Alex Andrews with us today from Willis Towers Watson. They're going to give you an overview of our benefits.
Good morning.
Morning. Morning.
My name is Connor Clune. I'm here with Alex Andrews. We're with Willis Towers Watson. If you're unfamiliar with Willis Towers Watson, we are an insurance broker consultant. We're one of the 3 or 4 biggest brokerage houses in the world. So we have partnered with Shawnee County for several years on their benefit packages. We provide everything from consultation around some of the products that they have in place to support for things like communications, compliance, evaluation of some of those different products, and really partnering with the team at Shawnee County to help put a benefit package together for the employees to help better attract and retain employees. So excited to be with you this morning. What we're planning on doing is just going through, the first page kind of has some highlights of our partnership with the WTW team and Shawnee County and some of the things that we've worked on over the past year or two. And then we also have some utilization reporting. So we'll walk through first your medical utilization, and then behind that we have some information from other vendors and carrier partners of Shawnee County. So that's kind of what we have prepared, and we have I think everyone should have received if you didn't, we have extras over here as well, a physical presentation here. So we'll get started on the first page. So the first page, these are what we call WTW partnership highlights. And if at any time anyone has any questions or wants any further information on any of the things that we'll walk through today, just let me know. So we've kind of broken these out by medical and prescription drug, which is kind of the big ticket item. Most of the dollars of any benefit program that we partner with, most of those, a good majority of those dollars are going to the medical and prescription drug program. So that's what we'll focus on, at least at the front. And then we'll go into some ancillary and communications items, and finally some compliance. So the first item is partnering with or negotiating the renewal with Blue Cross Blue Shield of Kansas. This year for the 2024 renewal, we were successful in negotiating a $30,000 admin fee credit that will appear on the January invoice. So this is to help offset the administration fee with Blue Cross Blue Shield. So it's kind of an incentive to renew with them. We were able to negotiate that $30,000 admin fee credit. We also provided consultation and support around the introduction of a qualified high deductible plan paired with an HSA for 2023. Shawnee County did roll that out, as I'm sure everyone is aware, and that's been a successful program so far. Has a pretty decent population enrolled there. Sometimes those things take a little time to get going, but I think that's been successful so far, the qualified high deductible plan. We provided consultation on stop-loss deductibles, and your stop-loss deductible right now is at $200,000, meaning that any claims in excess of that amount for any one claim would be reimbursed by Blue Cross Blue Shield of Kansas back to Shawnee County. We will evaluate at renewal different deductible options to potentially increase that deductible, which comes with premium savings. Those premium savings would need to offset the risk associated with taking on a higher deductible, so we kind of help in that evaluation. And then we will help develop the funding rates, and we'll project out the renewal for the next year. So basically what we're doing is looking at the claims, looking at the projected fixed costs, and we're trending those claims forward, and we're projecting those, and we're saying these are the rates that we would project, this is the funding that we would project for the next plan year. So that's a kind of a financial actuarial partnership that we have with the county, is providing support in that area. We also partner with vendors. So we, through our partnership, implemented Tria Health several years ago. And Tria Health is a vendor that monitors and helps support compliance with certain chronic disease states, and specifically making sure those people are staying compliant with their care, getting their prescriptions filled. If they're taking any prescriptions that may not be applicable or appropriate for their conditions, then it really helps partner with those members and helps with the compliance and the engagement. So we help monitor that. We also provided additional information for some new programs that TRIA has launched. So currently, the county partners with TRIA for kind of a chronic disease compliance, and then a diabetes program and a blood pressure cuff monitoring program. They've recently rolled out a couple new programs, one of them being a DNA testing program and another being a weight loss program. We did evaluate those programs, however, it was decided at that point that the county was not going to move forward with them. We do provide monthly financial performance, so this dashboard report that we'll get into on the next slide, we provide those on a monthly basis that helps Shawnee County see how they're running, how the plan overall is running. We'll compare that to the budget, compare it to the funding rates, and it gives visibility to the plan's performance. It gives visibility to any large claims that might be appearing as well. We talked about the underwriting projections, so that is an important part of our partnership. Renewal rate development. We also will do reserve calculations as well as part of our partnership. And then lastly, we also do financial benchmarking survey. This is a WTW service. It's our kind of proprietary tool. We call it FBS. We will look at Shawnee County's plan compared to benchmark plans, and we'll also adjust that for different demographic factors, plan design factors, and geography, and it really provides some visibility into how the plan stacks up compared to some of the things that we see in our benchmarks. On the ancillary and communications, we do help support open enrollment through guides, open enrollment packets, and the mobile wallet. Just help support the communication effort and getting the word out there for Shawnee County as you're going through open enrollment, which I think is starting up very soon. And then just a couple notes on the dental. So we did negotiate a rate pass, admin fee rate pass with Delta Dental this year. Shawnee County elected to hold dental rates, also elected to hold medical rates. That was, a reflection of how well the overall fund is performing with Shawnee County in that decision to hold rates. So we did another effort that we had in the past year is we marketed fitness and gym programs and assisted in the evaluation process. So that is something that we as a broker will do from time to time, is market these programs. We'll evaluate the different vendors, the different carriers in the marketplace, and help provide consultation around what vendor might excel in certain areas and others. So one of the vendors that we did evaluate this year was fitness and gym programs. Shawnee County ultimately decided not to move forward with any of those programs. We also evaluated a program called Cura Connect for at-risk employees. This would have been kind of an add-on to your current EAP. It's more targeted and it's a more proactive EAP. But again, Shawnee County decided not to move forward with that program. FMLA Link is another one we evaluated or helped evaluate, and this would be an outsourcing administration for FMLA administration. Ultimately, Shawnee County decided against moving forward with that. And then lastly, on pet insurance, we provided some consultation on pet insurance as there had been some interest on the county's part in providing a benefit for pet insurance. And again, ultimately, the county decided against that. So as you can probably surmise, part of our role is to help evaluate these vendors. And a lot of times, at the end of that evaluation process, that the decision's made, we're not going to go through with that process. And that's, we are completely agnostic. We're not trying to push any of these programs. Our role is simply as a neutral evaluator, a neutral arbiter, and providing some consultation in that process. So on the compliance front, the last couple years with COVID, there's been a lot of changes that impact benefit plans. So a big part of our compliance team has been providing consultation, providing information around the legislation for COVID-19, and helping all the plans stay compliant with that. Any legislative plan compliance questions that come up, Shawnee County implemented a qualified high deductible plan. With that, there's certain requirements as far as eligibility and as far as certain expenses that may or may not be eligible under a qualified high deductible plan. So that's been something that we've been instrumental in as well. Provide annual PCORI fee estimates. So as a self-funded plan, the county pays a fee. It's the Patient-Centered Outcomes Research Institute, or PCORI fee, in July, so we'll help with that. And then we lastly provide a WTW 2023 compliance calendar that just kind of helps put all of those different compliance landmarks or dates on the calendar for the county. So just a kind of a snapshot of some of the things that we've partnered with Angela and the team on in the past year. Any questions on any of that before we move into the dashboard?
No.
Okay, so the next section, the next couple pages, this is a dashboard that we prepare. So we get claims in from Blue Cross Blue Shield of Kansas, as well as Elixir and Prime Therapeutics. We're also including information on that we get directly from the county. And so we'll prepare this dashboard based on that information. So for this, we're looking at claims updated through August of 2023. And some of this we're comparing to that same time frame from before. But on the first page, this is kind of an executive overview, and it has some key takeaways. So the plan through August of 2023 is running at about 108% of projected cost, resulted in a negative variance of about $688,000. So that variance, that 108%, is basically calculated by the total cost of the plan. The total cost is mainly your claims, but it's also your fixed costs. So the fixed costs are the costs that go to, or the fees that go to Blue Cross Blue Shield of Kansas for their administration of the plan, and to Blue Cross Blue Shield of Kansas for the premiums. As you know, this plan is self-funded, so the costs vary quite a bit on a month-to-month basis as claims get paid. But through August of 2023, the plan is running over budget, essentially. There is an adjustment that's made to this as well, and we'll get into that on another page, but an adjustment that kind of brings that number down a little bit. But what's really driving the claims is the medical costs are, the cost for the medical plan is at $8.3 million through 3 months, which is about a 15% increase from the same point last year. So 8.3 million, if we were standing here a year ago, it would be at 7.2 million. So it's gone up quite a bit year over year. Some of that's due to large claims, and we'll get into some of those large claims in a little bit. And then the claims, so of that 8.2 million, most of that is through claims. Of that 8.3, call it 8.3 million, about 7.4 million is through claims. So those are the dollars that are being paid out to help pay for those both medical and pharmacy claims. And this is about a 15% increase in the claims dollars. So last year was about 6.45 million. So it's gone up. So most of that is due to simply claims utilization. You have 4 claimants that have exceeded the threshold, and the threshold that we track on this report is 100,000. So it's 50% of the stop loss deductible. The deductible right now is 200,000. So any claims that exceed the $100,000 threshold will track on this report. And you've had $775,000 in claims exceeding the $100,000 threshold. Net claims at 705,000. Some of those, the net number is reduced by stop loss reimbursements, which you have seen some stop loss reimbursements. Dental so far through 8 months is about 300,000, which again is an increase of about 15% from about 260,000 at the same point last year. And then if you look at the chart below, you can see it's showing the total cost compared to the accrual. And so what you'll see on here is that it shows that the total cost is exceeding the accrual for all 3 years. One of the things that Shawnee County does that's a little bit unique is that the way that they accrue for the health plan is not just based on the premium equivalents of the folks that are enrolled in the plan. It's also based on any positions that have been posted and not filled yet. They're still accruing for those dollars. So this graph below isn't accounting for that. So it's kind of, so I would take that, take this graph on the bottom left with kind of a grain of salt. We'll kind of show what that adjustment looks like in a couple slides here. As I said, we get information from Shawnee County that helps us make that adjustment. So, okay, and then page 3 is comparing year over year, 2023 to 2022, and this is the claims through August compared to last year's claims through August. So there is some seasonality in claims. So if we were going to show the whole year compared to this year, it might kind of skew that a little bit. So that's one of the reasons that we show it this way. But we have seen an increase in headcount. So your headcount's gone up about 7.3%. From an average of 834 to 895. And then, as we said before, a lot of what we're seeing here, we're seeing an increase in medical claims of 2.2%, a slight decrease, an increase in stop loss claims. So ISL adjustments, ISL stands for individual stop loss. So as I said before, $200,000 is a stop loss deductible. Anything above that gets reimbursed back to the plan by Blue Cross Blue Shield of Kansas. And then we'll adjust that down below, and it'll show that adjustment of about 0.6%. The drugs on this plan have increased about 8%. So prescription drugs have been more of a driver on the plan of about 8%. I'm looking on the PEPM column, by the way. Prescription drug rebates decrease about 9%, and overall, your total claims are up 15%, but a big part of that is because your head count has increased, so overall your claims on a PEPM basis are up about 7%. Down below, we are looking at, we included here some dollars for the HSA seeding. So this only applies to the people that are enrolled in the qualified high deductible plan would be eligible for the HSA. This was new in 2020, 2023, so there's 0 for 2022, obviously. But so far, not a huge number, but a little, $14,500 for the HSA. And then we'll look at the admin fee. So no change on the admin, about a 6.6% increase on the stop loss, and overall 3.7% increase for the fixed costs. So as we said before, most of that premium dollar is going to, probably about 90% is going to pay for claims, and then a much smaller portion is going to go to those fixed costs, the admin fees and the stop loss premiums. And then total costs is up about 7% year over year, or 15% overall. So that 7% is adjusted to make that on a PEPM basis to account for fluctuations in enrollment, which, as I said, your enrollment has gone up about 7%. And then down below, we'll look at large claims. So large claims below 100,000 have increased by 5% on a PEPM basis, and then those above $100,000 have increased 53%. So we've had 4 claims above 100,000, and those on average are bigger than what we've seen last year. And then the next slide is on dental. Your dental enrollment hasn't increased quite as much. It's about a 1% increase in enrollment. But the overall increase in claims is an increase of about 15%. And then overall, taking in the admin fees, so the admin fee is much less, $4 admin fee for Delta, or for the dental coverage. And then overall, your costs for the dental plan have increased about 13.5%. And then down below, I'm just going to kind of hit on a couple of these, but I think this on the top left, this is a graph that we had seen before, but I wanted to kind of touch on something on the next slide. But then that top right graph shows the kind of year-over-year trend for medical claims, and as you can see, that has gone up from about a little less than $700 in 2021 to almost $750 in 2023 so far. And then prescription drug has increased as well. And then the prescription drug rebates, so these are dollars that get paid back to the plan. So certain drugs, certain brand name drugs are eligible for rebates, and the manufacturer pays an amount back to the PBM. We're able to recoup those dollars from Elixir, so they pay those dollars back to the plan, so that helps offset some of the costs. So we're showing some of the prescription drug rebate dollars there. And then overall, it's showing that about $1,000 PEPM cost. And then, we'll look at down on the bottom left, it's kind of showing your average enrollment year over year, and as you can see, it has gone up in 2023. And then the bottom right is showing the employer cost share. So the Shawnee County is picking up 86 cents on every dollar for the health plan, and then the employees picking up 14 cents on the dollar. So this doesn't account for dollars paid out from employees for co-payments and deductibles and things like that, but the overall cost of the plan, what's being paid out for Shawnee County and what's coming out for employee contributions, that's what that is tracking. Okay, then on slide 6, this is looking at a couple other metrics, and I think the biggest driver of your increase in enrollment has been in this employee-only category. So you've seen quite a big increase, over 50 new enrollees in the plan in that employee-only category in the 2023 plan year so far. And then down below, we kind of show that line chart where it shows the enrollment. And you can see your most recent enrollment is above 900 enrollees, which if, back in Q1 of 2022, you were at 830, so it has increased quite a bit over that time frame. And then you can see where people are enrolled. So in this bottom right, so you have 33 people, about 4% of the population in the high deductible plan, 95% are in the active PPO plan, and then you have 7 enrollees in the retiree PPO plan. So, we talked a little bit about that high deductible plan at the outset. This is kind of where we'd expect it that first year. I think you'll see that year over year enrollment in that plan will grow as people get a little bit more accustomed to that plan. But for the first year, I think that is pretty good. And then on slide 7, this is looking at costs by quarter. So these purple bars is showing a claims number, PEPM, and then that yellow line is showing the 12-month average. So you can see quarter by quarter, your claims do fluctuate, as do self-funded plans. That's something that we would expect to see. Claims kind of go up and down. Costs go up and down as claims come in and get paid. But you can see there was kind of a jump there. It kind of stayed steady there until this last Q2 of 2023. It jumped up a little bit, about $1,000 claim number. And then down below, this is looking at the month by month costs versus accrual. The accrual is your budget number. So this is where that number stays the same. And then the costs will go up and down from a month-to-month basis as claims come in and get paid. Most months, as you can see, the cost is coming in above the accrual. We'll get into that. We talked a little bit about how the accrual, how Shawnee County adjusts that accrual, and so that's not being reflected there. And we'll talk about that on the next 2 slides more. But okay, I'm on slide 8. So this is looking at so the blue bar is looking at your claims, and then it's kind of a teal, lighter blue color is the total cost of the plan. So you have about 1158 is that total cost, and 1037 is the claims dollar. So as we said before, the vast majority of that dollar is going to claims, which is how you want. That's the intention of a self-funded plan. And a fully insured model, that administration is much more than that, and that's one of the efficiencies that you gain by having a self-funded plan. So about 90% of that dollar is going towards to pay for claims. And you can see it's kind of broken out down below. Not a big surprise, but the retiree costs are much more than we see on the active plan. There's only 7 people enrolled on that plan. You do have, some adverse selection, meaning that the people that are enrolling in that are typically people that have, chronic health conditions that really need that insurance. They're going to use that insurance. So not surprisingly, the cost for those retirees is about 4 times what the cost is for, an active employee. And then on the right, it kind of shows that the employer versus employee for those plans. As we said before, Shawnee County is picking up 86 cents on the dollar for the health plans overall, where the employee, through those payroll deductions, through the contributions, are picking up about 14 cents. And then it breaks it out from there. The retiree, again, that one, because those premiums are a lot more, they're picking up a bigger piece of that pie. Okay, then down below on slide 9, this is looking at the total costs versus the expected accrual. And if you look at this, we're comparing the January of 23 through August of 23. So this is like the current time frame compared to the prior time frame, which is January through August of 2022. And then I will direct you to this yellow bar down below where it says accounting department additional total. So these are dollars that we are getting from Shawnee County. These are additional dollars that are being added to the accrual for positions that are posted. And even if those haven't been filled, the county still accrues dollars to the health plan for those members. And that can be a pretty big adjustment. So when we were showing before on those slides how the county in most years had been, well under budget, this is part of the reason why, is because there's this accrual going on the back end. So about $820,000 year to date has been added to the accrual. And so that, even with that additional dollars, you're still, above where you would want to be. The costs are still exceeding budget essentially. But if we were looking at this last year, that after that adjustment's been made, the ratio of the total cost compared to the accrual would be, the cost would be just under that at 96%. And then, you can look above when we've kind of broken this out by plan, showing the different plans, the PPO, the retiree, the high deductible plan, and the Delta is lumped in there as well with those costs. And so that's why there's not a separate accrual number for the dental, but it's showing for those different plans, how the plan is performing compared to that. Not surprisingly, for this year at least, the retiree plan has performed very poorly, 341%, whereas the active PPO is about 118%. The high deductible plan, 29%. We do see a lot of folks that are enrolled in the high deductible plan that might be people that don't anticipate that maybe they're not dealing with a chronic health condition. They don't anticipate having to go see a doctor on a regular basis. They're not filling, high dollar prescription drugs, so that those younger, healthier members a lot of times are the folks that we see enroll in that high deductible plan, and their costs are generally lower. So that's probably what's going into that 29% number there.
Mr. Clune?
Yes.
Couple of questions.
Sure.
If we look at slide number 9, expected accrual assessment, and you were talking about that, I just want to make sure that I understood you correctly. This had come up during our budget presentation. If a department, audit finance, is budgeted for 29 people, but they only have 25 people, there's 4 vacancies, they're trying to fill those positions, or they should be trying to fill those positions, they're still paying insurance for 29 people, even though they only have 25 people, correct?
Correct. That's my understanding.
Okay.
Yes.
And so when you're talking about this expected accrual assessment, that's taking into account that you're paying for people that don't actually exist.
Correct.
Okay. And then I appreciate you pointing out several times the retirees, but again, we have 7 retirees, if I understand your presentation so far today, but the $1 million increase from 2022 to 2023 really falls in 2 categories. You have $600,000 in the ISL, and that's on slide number 3. You've got $600,000 increase on your ISL. That's under claims, right below medical before ISL adjustments. And then you have $400,000 in increase for drug costs. So those 2 areas that's where we have the $1 million increase. It's not really the retirees that's attributing to the majority of our increase in cost. it's in those two areas, the ISL adjustments and the drug costs. So, and I hope that we're going to be getting to, and again, the ISL standing for the stop loss.
Yep.
And our deductible right now is $200,000. So if we were wanting to stop that, would we want a higher ISL or a lower ISL?
Well, it really depends on how it's priced. And I will say, so these claims on slide 3, so these include all members. So it includes your active and retirees, so it's all lumped in there. But I agree with you. I mean, there's only 7 members, so I don't think that's your big driver of the increase year over year. But the ISL adjustment.
So on slide 9, you have retiree PPO, 248,135 versus the same period for 2022 at 120. So it's a $120,000 increase.
Right.
$120,000 out of $1 million increase. Yes, it's a doubling of that. I mean, I'm not going to deny that that's doubling, but that's not the majority of the $1 million increase.
Right. Yeah, I think part of the increase as well is because you did have a 7% increase in enrollment. So that's part of what's going on there. Because if you look at, but you're right. I mean, overall, these claims are, this increase is being driven by an increase in medical claims, an increase in pharmacy claims. It's those dollars being paid out.
When we look at the pharmacy claims, we have Tria Health that is supposed to be working to identify the cost of the medication, looking for, are there other alternate medications? But when I look at the Tria Health, our enrollment on Tria Health is relatively low. And I think that we have maybe less than 50 individuals total that are involved with the enrollment on Tria Health out of a potential 900 employees. And I know that those 50 employees, though, have some of the highest medical costs, so we do see a cost-benefit enrollment with Tria Health. So have you done an analysis of Tria Health and whether or not we could try to maybe encourage more of our employees to get onto Tria Health to lower that $400,000 drug increase?
I think it's a great point. I think the more engagement you can get in TRIA, the more enrollment. Now, TRIA only targets certain members. You have to have diagnosed with chronic conditions and taking, I think it's 3 or more prescription drugs that are prescribed to them. So of that 900, it cuts that number down pretty quick. And those are really the members that you as a plan and TRIA would want to focus on, because those potentially could be your high-cost members. They might be dealing with conditions such as diabetes, high blood pressure, high cholesterol, those types of things. And so the more engagement we can get in those programs with TRIA, I think the better outcomes you're going to see. Part of that engagement process is having an incentive there. So there is an incentive for members to enroll in the plan, to get their drugs at a discounted cost or free generics, I believe. So that is part of the program. But however we can encourage, through communication, through incentive, to get folks engaged and enrolled in that plan, I think it's overall going to help you in the long run.
Okay. On the stop loss, I want to go back to that.
Yep.
Current deductible is $200,000, which means once we hit that 200 threshold, we stop paying.
Correct.
And so if we had a lower deductible, would that lower the cost?
So you would pay a lot more in premium for that deductible.
Okay.
Now, it would lower the cost if you had members hitting that amount. It all depends on how many members are hitting that amount. If you are does those potential reimbursements offset the increase in premium that you're going to pay?
Well, I
So
think
it's
that
kind of
I think you identified that we had less than 4 claims.
right.
And so, and I think that historically, we've had maybe less than 3 claims.
Yeah, correct.
And so, wouldn't we want a higher deductible to lower the premiums? Or, I mean,
In general, if you're seeing less claims, most of our clients, we don't advise them to decrease their stop-loss deductible. Because large claims are getting bigger year over year, through trend, through different things, there's just an increase in the prevalence of large claims. There's no maximum anymore in the post-ACA world. So because of that increased utilization, because of leverage trend in the stop-loss world, we generally advise our clients to increase that deductible, not every year, but every few years or so, to take a look at that deductible. And it depends on how the carrier is going to price it, because what we'll do is we'll say, okay, if you're, if the increase is let's say you're going to save $215,000 in premium, but you're going to take on an additional $50,000 in risk for each person that approaches that, we can take a look back at your history and say, well, historically, you've only had maybe 1 or 2 or 3 claims that have hit that amount, so in most years you would win. Now, we can't say for sure that you would win in a given year, but given your history, given what we kind of are seeing, I think that's a recommendation that we would feel comfortable making based on the premium savings. So a lot of it is just trying to, weigh what the premium savings are compared to the added risk that you're going to be taking on as a plan by making that change. But in general, if you're seeing lower claims, if you think you can take, and some of it is just the risk tolerance of the client. If they felt like, we don't have the cash on hand, we'd rather pay it in premiums rather than take that additional risk, then that's something that can be considered as well. Okay, yeah. So for this year, it was $217,000 in stop-loss premiums to increase, in savings to increase from $200,000 to $250,000. So for 2024, the decision was made to go ahead and increase that deductible, take the $217,000 in fixed cost savings, and then if there were 4 or more claims exceeding that amount, then at that point, the county could lose. But historically, looking at, how many claims have hit that amount, there hasn't been that many, so we would feel comfortable making that recommendation to go ahead and increase and take the premium savings. Okay, and then on slide 10, unless there was any other questions, I wanted to get into, so these are the large claimants, and we have de-identified this information, obviously, so it's not, we're not talking about specific people here, but so there are 4 claims, and again, we're looking at claims of $100,000 or more paid out during the policy period. The top claim is a cancer claim, and some of these cancer claims, and another thing that we'll do with evaluating stop losses is try to get some idea of some of these claims. And when we look at the cancer claim, might be an ongoing claim, and you can see that hit in June and it's still being paid out. So that's something that going forward we'll certainly keep an eye on. This second claim, this looks like a preemie claim, so a premature baby. That claim hit in April, and since then the claims have really tailed off. So hopefully, that baby's healthy and is back at home and is doing well, and we would typically expect that's kind of a one-and-done type claim. So that claim we look at differently than maybe that first claim that's a cancer claim. The third claim is classified as a cardiovascular disorder, so this could be like, a heart procedure. It could have been like maybe even a heart attack or some sort of cardiac event. And again, this looks like a claim that was paid in February of 2023, so $120,000 claim there. But since then, it's been much less. So again, hopefully that person is doing better and is back at work, and that hopefully won't be an ongoing concern. And then the fourth claim, this is a acute respiratory failure, and this person was admitted to a facility, so it was an inpatient hospital claim. And again, this was paid in April of 2023, and since then has kind of fallen off. Overall, you have one claim that has hit $200,000. Now, there's still, a few months left of the year, but about $70,000, a little over $70,000 has been reimbursed from Blue Cross Blue Shield back to the plan. So we adjust that claim back down to $200,000, kind of net out those dollars. And then this next claim, this preemie claim, is getting really close to $200,000. But given that that's really tailed off, I don't know if it's going to hit that deductible, just because hopefully, as we said, that baby is healthy and is at home, and hopefully we don't see a whole lot more claims come through. And then the next two claims, again, they have trailed off a bit, but it's getting closer to that deductible of $200,000, about
Are you
100.
looking at these over a year period? I mean, does it reset each year?
It does reset each year, correct. Yep. Okay, and then this next slide, and this is just looking at monthly claims and monthly enrollment, and I'll just touch on this briefly, but your claims, we did see kind of a spike in April, and if you look up at this large claim exhibit on slide 10 and look at what happened in April, we had a $184,000 claim for a newborn. We had that acute respiratory failure, so we did see some claims come through during that month, and you can see that purple line kind of bumped up a little bit during that month. Since then, it's gone back down a little bit. And then on the exhibit down below, we're looking at enrollment, and that purple line is that 2023 enrollment, and it has been a little bit elevated, so that's a good sign. The enrollment in the plan is higher than it has been in prior years. So, and then back behind here, we have kind of month by month experience reports, and it's looking at the prior policy compared to the current policy, and it goes into a little bit more detail on all of these exhibits. I'm not planning on walking through these during this session, just because I think it's a little bit busy, but I did want to include those just in case there was any questions specifically, and it kind of goes into some of the different plans as well and breaks it out by those plans. But we've kind of shown a lot of that already in the dashboard report. So if there's no other questions on that report, I'm going to hand it off to Alex to go through the next section of the report.
All right. Good morning, everyone. Just to reintroduce myself, Alex Andrews with WTW. I'm going to be walking us through the ancillary utilization reports, so that's going to include dental, vision, TRIA Health, First Stop Health, which is your virtual urgent care, and lastly, your EAP, which is CureLink. So starting off on the first Delta Dental page, this is looking at your 2023 experience report. Just due to the timing of when we requested everything and we're getting items from carriers, this is January through July of 2023. Just wanted to call that out, as the last report Connor was going through was through August. And then rather than going line by line, month by month, I'm just going to focus on the averages for the year. So far, your average paid benefit per month has been just over $33,000. The average employee count has been 885 per month. The total dependents averaging out at 793. And then when we break that down to a PEPM amount, that is 3817 per employee per month for 2023. And then the number of claims there is averaging out at 228. The other thing I wanted to call out here on this page is the line graph below. Now that's just kind of a running total of your PEPM costs. So as you can see on the low end, your PEPM, so in January, for example, just under $35. And then on the high end in February, we were a little bit over $40 PEPM. Does anyone have any questions about this report? Sure.
Quick question. I don't see any data about premiums on here. And I'm sure that I could go back through my previous meetings and find that, but could we get a reminder on what we pay per employee?
Yes, we can pull that and send it as a follow-up for the tiered. Or is that what you're meaning, like per
Yeah,
level?
basically, I mean, I'd like to see kind of the data, just the data of what we're paying in and what our employees are paying in as a total. I mean, we see the enrollment numbers and how many people are coming into the plan, 872 in January. What does that aggregate out in terms of premiums paid versus what we're getting paid out?
Yep, and we can definitely follow up with additional data. The one thing I'll note now, so this is a self-funded plan, so you all pay currently $4 PEPM for just the administrative fees. And then we do have the accrual, so the accrual, which is the budgeted amount, and we can follow up with those various tiers and the cost for that.
Okay, thank you.
Yep, absolutely. All right, any other questions on 2023 data here? And I think just in the interest of time, I'll go ahead and skip 2022, but we did ask for a full year as well as the current year to date. So on the next page, you have your 2022 data. Then moving one more down to, it's titled Cost Management. This is showing kind of how the claims are coming in, and what Delta Dental is doing to help cost contain. So starting at the top with this summary column, you'll see year to date through 2020, or for 2023, you have had $632,000 in total submitted claims. Of those submitted claims, 626 have been in-network, which is a very high number. That's what we're hoping to see there. Now you see there are some duplicate charges, which Delta Dental, part of what they do to cost to manage is when there's duplicate claims, they're calling that out. They're making sure people aren't getting paid twice. So of that 632,000, just under 19,000 of it was found to be duplicate claims, so a savings of just under 3%. And the big one here, the Delta Dental difference, which we have a couple rows for, that is Delta Dental's proprietary network and discounting. So the savings they're finding from that is just over $227,000. So 36% network discount is what that comes out to. So just sliding down again, we'll see this Delta Dental difference. So the network savings, so that's the savings that they get for in-network providers. They're getting a reduced rate because they're in that network, has come out to 30.7% for the year. A couple other different savings items that Delta does every year is this consultant review. Very small this year, only $142 so far. But just for some background, that is, they will have in-house providers looking at claims and looking at potential claims come through. And if they think that maybe there's an alternative route that is maybe more effective and cost effective, they'll try to work with the member and their provider on going down that route. Non-billable services would be the next item, so that's going to be another good chunk of savings. So those are just excluded items that are being submitted, but again they're excluded, so they're being taken out just under 4%. And then coordination of benefits. So this is looking if people have duplicative coverage, if they have coverage from another system somehow, whether it's a spouse's plan or some other various plan out there. They're coordinating to ensure that not all of the money is just going right to the Delta. They're helping even that out and appropriately paying when needed. So looking down here at the patient pay, this is going to be what your employees and what your members are actually paying on their end. The two largest pieces are going to be not covered services. So again, those are those excluded fees that if it's just not covered under the plan, the employee would be on the hook for, or the member would be on the hook for. And then co-insurance is going to be your biggest item in that bracket. So that's everyone paying their deductibles, and then the split. So if it's a major service, it's a 50% co-insurance. So it's a 50-50 split from the plan and the employee. So that's how that's getting to just under 108,000. And then the other, you only have two others here that fell into this bracket, the over maximum. So your annual maximum, this is dollars that are going past that your employees would have to pay. And then the optional services, again, these would be more elective, not covered items that your employees would be responsible for paying. So the Delta Dental pay here, the next row, large row down, this is the actual dollars that Delta Dental is paying out, or really what you all, because it's a self-funded plan, would be paying out. So of course, the big chunk of that is going to be your co-insurance. So that's, like I said, for major, if it's a 50-50 split, 50% of it's coming from the Shawnee County, 50% would be coming from the employee up to that maximum amount. So the Delta Dental pay in that section is 61% of all total costs. Again, getting us to that grand total of $632,000 for the year. I know that was a lot. Any questions on this page?
Yeah.
Sure.
Is there such thing as a high deductible health plan for ancillary services, dental and vision, and stuff like that?
To my knowledge, no. There are dental HMO networks, so it's just a tighter network. That is an option. It's something we could further explore with Delta in future years, but there's really not an equivalent of a high deductible plan for dental, vision, things like that.
Okay, thanks.
Okay, so moving on, in these next few pie graphs, I'm just going to stay on the left side of the page. That's our 2023, but we did ask Delta to include 2022 to the right there. So starting with the benefit comparison page, this is looking at the network type that your people are going to get services completed at. So you'll see three different options. You have PPO, which is also more your in-network, traditional in-network plan. Premier, which would be kind of equivalent to that Delta difference. Delta Dental, just for some quick background, has their Premier network, which is essentially a secondary in-network option. These providers that are in that network do not take as big of a discount, but it's a way that Delta Dental is able to expand their in-network amount of providers by offering this. So you're going to get the best discounts by going to a true PPO provider, but you will also be classified as in-network and seeing large discounts through Premier. Now, out-of-network is self-explanatory. They are completely not in the Delta Dental service map. And as you can see here, for services completed for this year, not even 1% have gone out-of-network, which is really a great number. We want it to be zero, of course, but under 1%, you're looking really good this year as well. Sliding down again to so it'll also say benefit comparison. The next page, we're looking at how it's broken out by employees, spouses, and dependents. So of course, excuse me, employees are the largest portion of all dollars spent this year, coming in just under 53%, spouses at 11%, and then children, dependents would be 36%, which is a fairly common split of how we see it in our book of business. Okay, and then the last benefit comparison page here for Delta Dental. This is a bit of a busy page, but this really breaks it down by actual service category. So starting at the top, really these are going to be your two biggest would be diagnostic and preventive. So that's your, twice a year you go in, get your x-rays done, your cleanings done. That's going to fall into those two categories. So with those being well over 50% of the spend, that's where we want it to be. The next down, restorative, that royal blue color, these are your different, more enhanced services. So you have your basic services, things like tooth pulling, less invasive services, and then of course major would be things like implants or larger root canals, things of that level. And then further down, and we can move on just so we're not going through every different category, but they break out the basic and majors even a bit further. So endodontic and periodontic, those are your root canals and your gum treatments. Prosthodontics, so that's your implants and things of that nature. Oral surgery, again, is pretty self-explanatory. That's large or they compacted extractions. Nothing paid this year on orthodontics quite yet, but then your adjunctive services, and those are going to be kind of side services as well. So really, again, I think the main thing to call out here is seeing that the diagnostic and preventative are as high as they are. That means your people are going to get their teeth checked, they're getting their cleanings done. That's where we want to see the dollars being spent. So before I move on to vision, any final questions on dental or any of these reports? No? Okay. Okay, so we will jump down here. So for Surancy Vision, the reporting is going to look the exact same, just for anyone who doesn't know. Surancy is the parent company of Delta Dental of Kansas, so makes it kind of easy and helps us look at it a little bit cleaner. Same as dental, we're looking at January of 23 through July of 23. And then like I said, I'm going to stay down there on those average lines. So average paid amount per month is just over $4,500. The average employee count on the vision plan is 614, and the average dependent per month is 514. You've had so far an average of 28 exams per month, and then 117 material claims per month. And just so everyone knows, material claims would be your lenses, your frames, the actual vision equipment, we should say. And then looking at this line graph below, just as dental, you do see, obviously a very big spike there in January. Now, I just want to assure you that's still less than $13 PEPM. So I know the chart makes it look like it's a large spike, but on a dollar amount, it's still very low, which is also not uncommon. A lot of people at the beginning of the year will go get these services done. And then you'll see towards July, so midway through the year, somewhat similar to dental, it kind of comes in two large waves every year, so that's why you'll see a bit of a spike again in the middle months of the year. Any questions here? Okay, and then like I said, I'm going to skip the next page, but we did include the 2022 data as well for your review. Skipping on down to claims costs by service type here. So this is, again, kind of how we looked at it for dental, is breaking it out by the different service levels. So the largest to start with would be your exams. I can say that excluding other, so other services is the highest quantity, but your largest amount here would be really the exams and then the lens options. So people going to those vision exams and then getting the lens replacements are your two bigger spending items there. Frames and other lenses would be coming in there at the second and third and fourth place. Okay. So the next page, again, we'll skip. The next one is for 2022 and move down to claims costs by provider. So this is breaking it out by the different vision providers and doctors that people are going to. So for your group for 2023 so far, we've had 23 different exams at an independent provider. So that'll be Dr. Mays' in Topeka provider. That's not going to be a Target. That's not going to be, as you see here, you have Lens Crafters as Target and Pearl Vision. Those are called out because those are three of the big partners that Surancy works with, and they have certain plans and programs with them that kind of give enhanced benefits. But your other retail, that's going to be the big one. So that's going to include any other box store. I'm not sure what the big ones are here in Topeka, but we'll see Costco, for example, is a big one. Walmart, as I mentioned, is another big one that a lot of people will fall into. So a majority of your claims and dollars for exams are going to those other big box stores, but again, not really uncommon. And I, again, not knowing, I'm from Kansas City, so not knowing exactly all the provider options, there just may be less options for Lens Crafters, Pearl, and Target here in town. Any questions there? Okay. So sliding over to the next page, we have claims utilization by network. So just, again, this is kind of looking at the same thing, just in a different split. For our in-network, 98.5% of total services have been in-network this year, which, again, looking very good. Breaking that down, you have 86% of that is going to retail, and then 11.5% is going to your independent doctors in the area. Now, out of network, you're only looking at just under 1.5% of total spend. Again, we'd like to see that at 0, but single digits, low single digits is a very good place to be. Okay. Moving on here to lens distribution. This is kind of getting pretty granular into how those lens dollars are going out, but as you'll see, Your two big lens types here are progressive lenses at just under 42%, and then the single vision lens at just under 39%. Any questions about anything on vision before we move on to TRIA? Okay. Okay, so the next report here is for, like I said, for TRIA Vision, or for TRIA Health rather, and this is labeled page 3 is where I'm starting at their total ROI. Just real quick before I do jump too far, TRIA, the way they compile these numbers and their ROI is from the start date of when things were.
It's Angela's, our coordinator of a standing policy.
Oh, okay, okay.
Until we
So, just wanna
rescind
make
that
sure I'm not-
resolution.
Fair enough. Okay.
We're not supposed to sit
Good to
more than an
continue?
hour.
Okay, okay. So as I was mentioning, with TRIA, they are compiling these numbers to give you data since they started their collection. So this is January of 2018 through 2022 data. So just wanted to call that out. I know we were looking at year-to-date so far, but this is a total collection of your investment and savings with TRIA. So this savings summary, this goes into the 3 different ways that they analyze their savings. You have RX savings, which are hard dollar, and we'll get into each of these individually. Next is your healthcare savings, and then compliance savings. And as Connor mentioned, I think he mentioned compliance with TRIA. That doesn't mean like governmental compliance, that means medication compliance. So are diabetics doing things correctly? Are they testing themselves? Are they doing the right insulin, right? That type of compliance, just want to.
So when you say hard dollar savings, explain exactly what that means.
So that would mean, for example, if someone is on a high-costing brand medication, but TRIA identifies a generic replacement, that would be a hard dollar save. Let's just say for numbers' sake, the brand is $1,000 per month, the generic is $100. You're seeing a hard dollar savings of switching medications of $900. Those are true. If you didn't make the switch, it would cost more. They're true savings amounts. Yeah. So by taking all of these together, they're coming up with a 5.45 to 1 ROI. Now, depending on kind of your stance, they also break it down for just the hard dollar savings, and that's 1.89 to 1. So even if you say we don't necessarily consider the soft dollar savings, you're still coming out ahead with just the hard dollar. And lastly, the total fees, again, this is over a course of 5 years, but the PEPM, or the total fees, I'm sorry, they listed it as PEPM, but the total fees have come out to $174,000 over the last 5 years with TRIA. And then moving on, so to page 4 here of the TRIA report, we're going to go into each individual savings category. So just to start, the first thing I want to call out here is this PAP. So these top 3 lines are PAPs. That is their pharmacy advocate program. So that's the basic program when they identify a member with chronic conditions who's taking a lot of medications. They fall under that program. Get a lot of questions on what that means, so I wanted to call that out. So we have 3 different PAP categories. We have generic substitution, so that's what I just alluded to. Someone's on a high-costing brand, and we're able to switch them over to a generic that does the same thing for less. The next one would be a less expensive substitution. This would be more of the same thing, but brand to brand. So if brand A is more high-costing than brand B, that would be and switching to brand B, that would be where that would fall in. And then discontinued medications is pretty self-explanatory. That's just where TRIA either thinks, their providers and nurses say, maybe you're taking 2 medicines that kind of do the same thing, let's just get you to 1, something of that nature. Or you're taking medications that, based on your current conditions and what your needs are just completely unnecessary. Working with your provider, that's when those will fall into that. So they have several others. I think a few of the big ones I wanted to call out here, the 5th line down, DPP-4s and GLP-1 drug discontinuation. Those are just big in the news right now. Those are the things like Ozempic, the different weight loss medications that fall in that category. So the drug discontinuation on that, they've seen 14 of those over the last few years. And that's a lot of times if someone is taking them off script. So when Ozempic really came out, it's a diabetic medication is what it's listed as. people were writing it off script and using it for weight control. So TRIA is going in and saying, if you're not using it as it should be prescribed, that's when they're discontinuing and again, finding an alternative, but that's where those are coming up. The duplicate therapy, so they do have a separate row for that. So that's, I guess, more of an example of when you're taking two medications that are doing the same thing. They have some diabetes change here, cholesterol. And as you can see, diabetes, cholesterol, blood pressure, those are their big conditions. So you're going to see a lot of those specifically. Moving over to our healthcare savings, this is going to be more of those soft dollar savings, as we call them. Part of what TRIA does is they evaluate by getting people healthier and adhering to the proper medications, adhering to what they need to be doing. They estimate that you've had 3 people avoid an urgent or an emergency room visit here, right? So they estimate that at $1,917 per visit, and that's how they're coming up with that $57.51. Again, they think by doing what they've done, they've helped avoid 92 urgent care visits, coming out to just over $13,000 total. 312 PCP, so that's your primary care physician avoidances, 57 specialist avoidances, and 14 lab avoidances. So this number, and just so you all are aware, these average savings amounts that they compile, that's TRIA's data, and they're estimating those numbers based off general data that's available to the public. So an ER visit, it might not be here in Topeka exactly $19.17 per visit. That is just how TRIA, they're using those numbers based on national surveys and data that comes out from all sorts of health committees and things like that. And then the final page here, page 6 for TRIA, like I said, we have our compliance savings. So they have 5 big categories that they're doing this in: asthma, diabetes, heart disease, high blood pressure, and high cholesterol. Over the years, they've had 15 different occurrences for asthma, 59 for diabetes, 8 for heart disease, 58 for high blood pressure, and 24 for high cholesterol. Now, it's no surprise to us that diabetes and high blood pressure are the prominent ones. Those are the programs that you have in place. That additional blood pressure service that you all offer is why they're getting a lot more of those folks. More folks are testing, more folks are in it, so that's how they're getting a higher number there. Grand savings for this over the last 5 years is coming out to $561,000. Any questions here on TRIA before we move on to First Stop Health? Okay. Okay. So just to preface, First Stop Health, we're going back to just a calendar year 2023 look at this. So this is 1/1 through 7/31 of this year. So looking at the performance at a glance, not gonna go through every number here for you all, just to help you out with your time, and I know you all are busy, but a couple of the big numbers we want to look at are annual utilization. So current year to date, you're at 29.4% utilization, which is great. For services like this, you're often going to be in the 10s to teens range. Your team with, I know with HR, we've done a lot of communicating these programs over the last few years, big pushes, telling people, if you have maybe a need for urgent care, try this first, right? So that's why you all have such a high utilization there. Looking at an average amount of employees of 897 this year. Total savings First Stop Health is coming to is just over $42,000 for the year. And this employee hours saved, this is another one I like to call out, 220. The way First Stop Health is coming to this number is after you use First Stop Health, you fill out a survey and they say, what would you have done if you didn't use First Stop Health? Would you have gone to the ER, urgent care, your primary doctor? Would you have done nothing about it? And by completing their services as quickly as they do, that's how they come to this. They estimate, and I don't know the exact, and we can get it if needed, but they'll say a ER visit's 3 hours an estimate, right, per service. By getting someone on the phone, you'll see on the next time it's 8 minutes to connect with one of their doctors. That's how they're coming to that number. So I always think that's a very interesting stat because it is showing how they're helping keeping your people, one, not just sitting in waiting rooms at the higher costing places like ERs and urgent cares. It kind of shows their day-to-day true value and how they can help your people. Sliding down to the next page, again, to call out, 8 minutes is the average time to connect with, or median time to connect with a doctor. So that's from when you either submit your application or you just call in. It's approximately 8 minutes till you're on the phone with a physician. And some of this is just duplicative. The bottom left pie chart here, also want to call that out. Overwhelming majority of your folks are using the mobile app, so that's just under 54% of services done. The next largest is just over the phone at 34%, and followed by just using online computer services at just under 12%. And then the last thing on this page I will call out is the top symptoms. So you're seeing cough, bronchitis, chest congestion, sinus issues, and sore throat, which is really what this is designed for. Again, we call it virtual urgent care, telemedicine. You'll see those terms interchangeably. This is not for breaking bones, right? You can't get a cast virtually. This is not for major things like heart attacks or strokes. But if your kid is feeling sick or you're feeling sick and you're trying to stay out of an urgent care, that's what this is designed to do. So moving on to the next page here. This is the bottom left-hand chart kind of goes into more of what I talked about when you get that survey of what would you have done if you hadn't used First Stop Health. So according to them, for 2023, 75% of your people are saying we're avoiding just a doctor's office visit. So that would be your primary care physician. The next biggest would be urgent care avoidance. So 14% of people are saying if I wouldn't have gone to you, I would have gone to an urgent care, the Minute Clinic, something of that nature. And then the other one that we like to focus on, 2% have said they would have avoided emergency room visit. That's the high ticket one, and we want to see that as high as possible. Again, this is not for arm breaks, this is not for major services. So typically you're going to see you're avoiding doctor's offices and urgent care as the two big ones. But again, that's by design.
And just to be clear, I mean, it says here 71% of those folks got a prescription, so
Yes.
we're not incentivized to just tell people to not go to the doctor, right? Like,
Right.
I mean, if somebody needs help,
Yes.
they do tell them to go or
Yes, and they
provide them
will-
help. So
Absolutely. And just to add one note, prescription drugs are not free under this. So if you meet with a physician virtually and they prescribe you amoxicillin or something like that for the flu, that is paid through by the plan. The employee will then use their Prime Therapeutics or Elixir Therapeutics cards. They do pay for those just using the co-pays, deductible structures as well.
I just didn't want it to look like, we're celebrating like, hey, we talked all these people out of seeking medical care. That's not the case, right?
No, exactly. We're not trying to tell people don't get yourself taken care of. We're just trying to find cost-efficient ways to do
Right.
so. And then the bar chart here on the right-hand side, again, that kind of breaks down these different avoidances by category. So again, First Stop Health has proprietary numbers they use. They estimate a doctor office has a per person visit count or a dollar amount. So for this year, they think $28,000 in avoided doctor's claims, $8,000 avoided for ER claims, and then $6,000 avoided for urgent care claims. And then I'm going to skip ahead to the blue slide here is just the kind of First Stop Health, their motto and plan, so we just wanted to include that. But sliding down to the guarantee performance page here, so again, looking at $42,000 in total savings. So again, looking at this bar chart here, $42,000 in total savings. Your investment has been just over $34,000 in fees, so a net savings of $8,000, 23% ROI. And then the next one, this engagement highlights, again, this is, we can kind of skip over this. This is something they include. This has their engagement calendar, so this is their topics of the month and kind of how they're talking with people. Also, your top subject lines, they include this, but this is the notifications that are coming to you. So the biggest one is your visit summary, so they'll always send you a summary after you meet with one of their doctors, and then your sick note. They'll also help provide that if people need it for managers or anything like that. So any questions on First Stop Health before we move on?
So on the annual utilization is 29.4%. Out of, when you look at other companies and other employers out there, is that a good number? I mean, it seems awfully low, when it seems like the benefit of this could be pretty great when, you know, I know a lot of folks, if their doctor is part of a network here in town, they call because their kid is sick or whatever, and they just say, take them to urgent care. It seems like very common thing to happen, that they could easily call this and not have that. I mean, I remember when my kid was little and he had an ear infection, we call and say he has an ear infection. So you got to bring him in and we'll check that out.
Right.
And it seems like I always was frustrated. Like, how come you can't just prescribe amoxicillin? We know that's what the end result is going to be. This is something that I think would avoid all of that.
Yeah, you're correct. And again, that is the idea and design of First Stop Health, is for helping, again, avoiding those urgent cares. Especially, it's huge for parents of kids in like those elementary ages, right? To avoid a sick day, to avoid pulling them out of school. We can get book of business utilization numbers from First Stop Health. I will say with my clients that have them, this 30%, you all are on the higher end. You know, these aren't programs you're necessarily going to get 99% utilization from. Part of it is just people, you know, maybe not knowing that it's offered. So there are communication campaigns done throughout the year, and that's something we assist Angela and the team with. First Stop Health also actually does a very good job of doing targeted outreaches. So where applicable, if they have people's email addresses, if they have people's home, they will often send either mailers or they will send emails just out reminding people, here's a service that your company pays for, please use it, here's the things it does. And again, we can certainly help and assist with trying to push these further throughout the year. But I'll ask First Stop Health for just overall book of business numbers from their end to see how you all stack up to their full book.
Okay, that'd be great. Thank you.
Absolutely. Anything else on First Stop Health? Good. Okay. Sorry, go ahead.
And all your number crunching and all your graphs, did you find anything where we're really out of the ordinary, or are we very typical in our numbers? Or?
Again, for my book of business, I think for these programs, you're all in very, very much in line. I have a couple groups that are closer to that 40%, so a little bit higher, but then I also have groups in the low 20s. I would say the low 20s is typically the lower end of utilization for First Stop Health. So you all are kind of right in the average number that I'm seeing, again, on my personal book. But I will get further numbers from them. You know, the next one here, we're going to go into your EAP utilization. This is one where I think we have some work that we could do in enhancing and getting more people on board. But before we move to that, for your TRIA health, your dental, and your vision, we think you're really right in line with most of our book of business on spend and on usage. So no major red flags stick out when we reviewed this for those different lines. Okay. So again, this is the last report we have for you today. This is from CuraLink. This is your EAP provider. We've got just a few quick program overviews here from them. But really the main one I'm going to call out is this program, and this vendor was implemented 1/1 of 2022. So we're about a year and a half into using them and have seen some numbers come through that, again, I think we have some work we could certainly do on help improve enhanced communications on. But if you go to page 2 here of the CuraLink page, your utilization is that top gray line there. That's the percentage-wise. So your population is employees and dependents. That's where that 1254 is coming from. Your cases are individual people who are outreaching for therapy services, for the financial services, for the legal type services. So quarter 1 of 22, we had 7 service cases, quarter 2, 12, quarter 3, 12, and quarter 4, 9. So your overall utilization for this for 2022 came in at just over 3%. I know that will probably be an alarming number. I will note EAPs are not something, honestly, even getting double digits is going to be typically a little bit more rare, especially when you have a lot of different usage or a lot of different programs in your benefit package. Sometimes you will see higher utilization when companies just kind of throw an EAP and that they try to cover a lot of bases with that. You'll see a little bit more. But typically on average, we'll see numbers around 5% for EAP utilization. So again, you are on the slightly lower end of that. Now, part of that may be due to the fact that CureLink is newer. So again, we've still been working with them and the HR team to kind of push communications and direct people to that resource as needed. The other one here, this item 2, case resolutions. So as you can see, all of these different cases were resolved by using the EAP. So that means if someone was using the EAP for therapy, for going through some life event or a tough time, they were able to get the help they needed through the EAP without using a different or an additional service. So again, I know the numbers may seem low here, but the thing we're happy about is they're getting resolved when they are going there. So I'm going to slide over to page 3. This is the kind of financial offset here. So kind of going through this chart in the middle towards the bottom section of the graph, the average, and that says employees, but that should be covered people, that 1254. So that's the number we give them. We self-report this, and that's how they charge us. So 1254 was the number used for 2022. The PEPM cost of $1.31 brings your total cost up to $19,713 for the year. Now, going above that, they have their different savings by category. So the first is your healthcare cost. They've saved an estimated $30,000, just over $30,000 from that category. Human capital costs, so this is things like productivity and turnover, coming in at just over $36,000. And then just organizational costs. So these are the different overarching supports that they provide to the company, or to, again, more to the HR team directly, coming in at $1,050. So total savings estimated at just under $68,000, bringing that ROI to 3.45 for the year. Any questions on the financials piece of it? And then, the next few pages, we were going to leave with you all. Again, this is more of a breakdown about those individual services and cases. I think really the one I was going to focus on is actually on page 7. So this is the primary presenting concern. So this really breaks it down as to, what is it that people are calling in about. So if you look in Q1, this column, you'll see you had one person call in because they needed help with childcare. Now that could be they needed help finding a daycare or coordinating just all child care services. So that would be under that. You had one case for depression. You had 2 family services. So again, that's going to be that kind of family counseling, things of that nature. And then the last category for Q1 was personal stress. You had 3 people. Again, I'm not going to go through each line here for you all, just in the interest of time. But as you can see, really the main usage for this is a lot of the counseling, the stress, the therapy type services. With that said, you will see there's legal services that are offered through the plan. There's that family care services. Elder care is another one that you're starting to see a lot more people. So if you have a parent living, an adult parent living at home trying to get the care they need, this is a great resource for that. Over the 2022 year, just looking at the pie chart, or the line, the bar graph at the bottom, you did have 3 legal counseling. So what that's just a 30-minute consultation with an in-network legal team that they have. So those are for things like if people need help preparing wills, right? Or doing kind of those basic legal services, they have options for that. Financial services, you didn't have anyone use that this last year, but it's a similar thing. You can have a meeting with a financial advisor, and they'll help people, give people info about, start setting up an IRA or doing those types of different types of things. Now, if people want to continue services with the legal counsel or the financial counsel they were assigned to, they can do that at a discounted rate, and that's another advantage. It'll help provide your members with discounts for those types of services. Okay. And then this last page, and I won't go into too much, but this is just the how people are accessing. This is the technology side, so you see a lot of people You had, for example, 4 different folks in last year used the mobile app feature. You had the Savings Center, so that's one of their on their website. It's just a category of services that they have that they can use. So again, not going to go through each of those, but just wanted to leave you all with that. And that is the end of our utilization reporting. Were there any questions about either this last EAP report or any of the others that I went over?
Any questions?
Okay. Thank you all for your time.
Thank you very much.
Appreciate it.
I know you've heard a lot about benefits today, but we just wanted to share that open enrollment is open and available. We have our first meeting starting today. It runs from 1 to 3 at Reynolds Lodge. On Tuesday from 10 to 11, and 1 to 2 will be at the Adult Detention Center. Wednesday, we have our meetings here from 9 to 11. Thursday at the North Annex from 6:30 a.m. to 9:30 a.m., and Friday from 9 to 10 at the Health Department and 1 to 4 at the Law Enforcement Center. I'd be happy to answer any questions you may have about open enrollment. And for open enrollment, you do have to log into BenTech and enroll. And if any of you in the room or any employees need help with that, please let us know.
Thank you.
Angela, with the open enrollment times, do any of those accommodate like the third shifters at the jail or anything like that? Or?
Not so much the third shifters at the jail as far as a meeting, but we have set the times so that we get first and second shift, and third shift is off during that time. But if anybody has any questions between 8 and 5, they can always call us,
Okay.
and we can help them with
All
that.
right, appreciate that.
Any other questions, comments? Thank you very much.
Thank you.
Thanks.
All right. I guess, look at the agenda. Next on our agenda is public comment. I don't see anyone here. So we'll skip on down to administrative communications. I think we just had one. So I think we're adjourned. Thank you.